And for COVID-19 screening is high at full spectrum emergency and urgent care, yet healthcare workers here are not listed in the first tier to get the vaccine.
I don't know the logic. It really is beyond anything that I can comprehend.
Tabitha Sylvester is among staffers here who screen 150 to 200 people a day for COVID-19. With a positivity rate of 10 to 20%, they're arguably on the front line and at risk of exposure.
Being able to take a vaccine not only keeps me safe and keeps my family safe, but it keeps my patients safe too.
According to state guidelines, the first tier to get the vaccine includes hospital staff, long-term care workers and residents, EMS transport workers, and home health care workers.
Because we are providing a lot of service to the public because the hospitals are so busy.
The second tier includes staffers at outpatient care offices, doctors and nurses at freestanding emergency and urgent care facilities, pharmacy staff, public health workers, and school nurses. Paul Mayer wants a more equitable allocation of vaccine.
My freestanding ER, because we're privately owned, is not bumped out of Tier 1, but the freestanding ER right down the highway that is owned by one of the big hospital systems is eligible because they're owned by one of the hospital systems.
When asked, staffers have found it difficult to explain that they will have to wait to administer the vaccine or get it themselves.
It should be based on the job that you do and the exposure you get every day, not who you work for.
Why does it matter where I work versus what I do for work? I'm a frontline nurse, and that should matter.
Late tonight, we did hear back from the state officials there telling us that the tier system is nothing more than a guideline for planning purposes, also telling us that providers are encouraged to vaccinate all healthcare workers. Still, that guideline alone is raising eyebrows here at the urgent care facility where we are live tonight. Darian Trotter, Fox News at 9.